Hi friends, I'm pretty sure you guys must have done very well in today's exam. So let's discuss few of the recalled general surgery questions like in this session 1 video that we have got from various students over the messages. So the questions were very straightforward and simple, directly asked from your standard textbook. So in this video we shall be discussing around 10 to 14 questions. So let's begin our discussion. So you had your first question, like a simple straightforward question where they had asked you regarding the role of D in ABCD of trauma. So what does D stand for? So the answer over here was disability assessment. So this is a concept that has been discussed multiple times in your regular classes and in your revision classes also, and we had put forward this question in one of our Fmge revision series also, where it was given as an option D for disability assessment. So the basic primary survey role is to identify and manage the most life-threatening injuries, where A is for the airway with cervical spine control, B is for breathing, C is for circulation, D for disability assessment, and E for exposure. Then we had the next question where they asked regarding the causative agent of gas gangrene. This was also a straightforward question, right, where the answer being the Clostridium perfringens. Right, as you can see, this has been taken again from your Bailey and Love textbook, where they have said Clostridium perfringens is the cause of gas gangrene. Right, then this is a repeated question that was asked. So what we could gather from the students, it was the image of the esophagus showing the presence of a coin, and there is no brain over here. The answer would have been esophagoscopy. Right, then again a repeat question that was asked regarding the conduit used in CABG. Right, so now there's a confusion whether it was an arterial or a venous graft. So if you can see over here the selection of conduit, in case of venous graft, it is the long saphenous vein which is the most commonly used venous conduit, whereas in case of arterial grafts, it is the left internal mammary artery or the internal thoracic artery which was used. So depending upon the question what it was, if it was an arterial, then the answer would have been lemma. If it was venous, then the answer would have been the long saphenous vein. Right, now moving on to the next question. Which of the following is not a component of QSOFA? This is a straightforward question. So the question is asking you not, and the answer would be pulse rate more than 90. This is not a component of a QSOFA score. The component of QSOFA score includes respiratory rate more than 22 per minute, right? Systolic blood pressure less than 100 mm of Hg, and altered mental status. So the answer would have been the pulse rate, or whatever the options. We have got varied options, but the main important thing is the QSOFA comprises of the respiratory rate, systolic blood pressure, and altered mental status. Right, then there was another score which was asked to you, which was regarding the CTP score, which is your child Turcotte score. So they had asked you which of the following is again not a component. So the key over here is to read the question very carefully, not to miss on these keywords which include not. Right, so we have bilirubin as a component, INR as a component, ascites as a component. Right, so the answer would be your hemoglobin or whatever would have been there in the option. So what are the components of CTP score? So your CTP score consists of bilirubin, albumin, ascites, encephalopathy, and INR. So we got varied options for as the fourth option. Some said as hemoglobin and some had put some other option, but then just remember the CTP score including of bilirubin, albumin, ascites, encephalopathy, and your INR. Right, so if you look at the scoring, it is provided a score of 1 point, 2 point, or 3 point each, where your CTPA is around 5 or 6 point, B is 7 to 9 points, and C is 10 to 15 points. Right, now the next question was your image based question from the breast, where your students have told us that an image of around PUD orange was given, and they had asked the definition of it, basically what is the cause of it. So yes, it is due to the invasion of the subdermal lymphatics, which is the cause of pudy orange. So if you see, this line might again have been taken from the Bayesian law. So this pudy orange is a sign of locally advanced disease due to obstruction of cutaneous lymphatic drainage of the breast by the infiltration of either subdermal lymphatics or axillary lymph node by tumor cells, right? So it was an image of pudy orange where they were mainly asking regarding the involvement of your subdermal lymphatics. Then another question, as we had already discussed a lot many times, that anal disorders 1 or 2 question is mandatory. So they had asked regarding the gold standard investigation for fistula in ano. So I hope there is no confusion regarding it. This is again a line which is directly taken from your Bayesian law, which says MRI is the gold standard for fistula imaging, right? So here your answer would have been MRI fistulogram, right? Now this question has been discussed multiple times, right? The important charge. So it was basically a clinical based scenario, and they were asking from which stage of shock is the urine output likely to be decreased, right? So this table taken from the ATLS 10 guideline clearly says over here, if you look regarding the urine output, in class 1 it remains normal, so in 2, whereas in class 3 it starts decreasing, right? So what they wanted to ask is from which stage, right, from which class does urine output begin to decrease, right? So here the answer would have been your grade 3, right? And now next is a very straightforward question asking you regarding the diagnosis. So it, as the information got from the students, it was an image based question. So if you can see over here, right, the biconvex hemorrhage, so it is a case of ADH. So we had again discussed this in our classes. So this would be a biconvex ADH, right, where it the injury happens to your middle meningeal artery. And if you see over here, this is your sub DH, which is this concavo convex, right? Now there were a lot of questions from the urology section to this time, and they were pretty straightforward questions like the lymph node involvement in testicular carcinoma. So it is para-aortic. It is absolutely taken from the image in the Bayesian law, where they say that lymphatic drainage of testes to para-aortic lymph nodes. Then there was another question regarding your lymph node involvement, and it was asked for the prostate carcinoma, right? So here the answer would be internal iliac lymph node. Now if you read this lines from the Bayesian law, in prostate CA, the lymphatic spread may occur via lymphatic vessels passing to the obturative fossa or along the sides of rectum to the lymph nodes beside the internal iliac vein in the hollow of the sacrum, right? So this was a straightforward question which was again asked from your standard textbook of Bayesian law, right? Now we have another question which was asked in a very twisted way. This is a quite often repeated question in your Fmge exam, which is regarding the constriction of the esophagus. And now they were asking regarding at 25 centimeter from incisors, which is the cause of constriction, right? So if you look at the diagram from Bayesian law, at 15 centimeter you have your cricopharyngeal sphincter, at 25 centimeter you have your aorta and bronchial constriction, and at 40 centimeter you have your diaphragmatic and sphincter constriction. So at 25 centimeter it would have been your aorta. Some students have told it to be a bronchial, so it would be in either a aorta or a bronchial constriction. Now another question that was asked from your venous disorders was regarding the gold standard treatment of the varicose vein, right? So if you look at this line over here, the endothermal ablation technologies have replaced the surgical ligation and stripping as the gold standard treatment, right? Once the randomized trials demonstrated they were marginally safer and have extremely high technical efficacy, offering superior quality of life post procedure, and equivalent improvement in quality of life in the longest term, right? So the options that we have got are like surgery, compression, and endothermal ablation. So the answer would have be endothermal ablation, right? So these are few of the questions, 14 of the questions that we have got so far from you all. So I'm pretty sure there would be a few more questions that must have come in your exams. So we'll be coming up with our session 2 of this very soon. Until then, you can absolutely post your questions that you come across either in the gamers club, which is in the Facebook, or you can follow our telegram channel and post it over there, right? So I hope this session was useful, and all the best for your results, and I'm pretty sure that you all would be passing with flying colors, right? So this is me signing off from the team Game Surgery, right? And please share other questions that we might have missed in this we might have missed in today's session, right? Thank you.